Hey guys, I wanted to take a few minutes to talk about seasonal affect disorder. So, some of you may be familiar with it. I'm going to give a really brief description of some of the symptoms that are associated with SAD, what it's called. I'm not going to go so much into the mental health aspects of seasonal affect disorder, but what I really wanted to touch on was how it can affect what we eat, how we eat, what we want to eat. So, and by the way, this is also true with PMS. So, in both seasonal affect disorder and premenstrual syndrome, there is a dysregulation of serotonin, which then, as we're going to talk about, actually increases carb consumption or cravings. Because when we ingest carbs, guess what? Our serotonin levels go up. So, seasonal affect disorder is a marked increase of depressive symptoms that comes on about this time of year. It affects 6% of the population in a pretty profound way and about 14% of the population in a milder way, like a less, a version that may not require intervention per se. How might you know you're experiencing it? Well, tiredness and fatigue is one of the big symptoms. Difficulty finding motivation, a lack of interest in activities that you would normally enjoy, foggy headedness, difficulty sleeping, and that actually is because serotonin is directly correlated to melatonin production. And then interestingly, even increased pain sensitivity, changes in blood pressure regulation, and difficulty with mood regulation. So I think that's really interesting. And again, that happens both in seasonal affect disorder, but also during PMS. So what studies have found is a direct correlation between reduced serotonin synthesis and carbohydrate cravings. Namely, as I mentioned, ingesting carbs actually increases the serotonin levels that we have. So it's no wonder that we crave it. So for most, carb cravings get worse as the day goes on. I don't want to say get worse, feel stronger. And there's a variety of reasons why that may happen. Probably, if you just think about it, like you're tired, your resources are drained, I would say that with that probably comes a shorter fuse in terms of frustration tolerance, patience may be lower. All of those things tend to be harder at the end of the day. We also are less busy. So it's like as the day winds down and we find ourselves sort of slowing, we have fewer distractions to keep our mind from from those cravings. So if you're trying to stick to your macros, trying to stick to a nutrition plan, what do? Do you just like white knuckle it and bear through these? Sure. I mean, that's one approach. But I want to offer some ideas that might make it a little bit easier, considering that, again, like I'm part of the reason I wanted to do this video is to normalize that your brain is actually signaling that you need carbohydrates because you need that serotonin level to go up. So one of the biggest things that I would recommend is that if you're not a planner, if you're not someone who's planning out the day, this is going to be very challenging to do, what I'm going to suggest. It's not impossible, but I think this really, really requires that attention to planning. So know yourself. If you are one of those people that around 4, 5, 6, 10 o'clock at night, that's when the cravings are hitting. Adjust your day so you're getting more protein and fat in the mornings and leaving room for starchy and sweet, specifically starchy and sweet carbohydrates for later in the day. That could be fruit. It doesn't mean that you're going to eat a box of candy. It just is when they have done studies, what they have found is that tends to quell the craving better than eating something that it does not have that characteristic to it. So what they have found is it's not like you don't have to eat a cake. It's 30 grams of carbs that's been associated with a marked increase in mood, in reports of mood. So that's 120 calories. So when you're thinking about it, I really want you to think about, okay, I'm going to plan some extra room for carbohydrates, either starchy carbs or sweet carbs, during the window where I have the most significant cravings. And to that, I would say don't have things that are high fat and high carbs. This doesn't become a reason to eat the cake. Like I said, it's really more of a way of addressing what your brain is telling you that you need. So about 30 grams of carbs, ingested alone, believe it or not. So it's not about having the carbs necessarily with the protein. They actually have found that ingesting them without protein can actually create a higher level of satisfaction in terms of mood. Most importantly, it's finding things that feel satisfying to you. So the second thing that I would recommend, other than planning and making sure that you've got enough carbs for that period of time that you struggle with, is again making sure that you're not picking foods that are high carb and high fat. So 30 grams of something like a low-fat cereal, pretzels, popcorn, those kind of foods may be effective. The other thing is thinking of foods that may take a little bit longer to consume. So if you think about something that you could just gobble down real quick, you may not get the same level of satisfaction as something that takes a little bit of time, like popcorn, or something like a hot chocolate, right? It's really hard to guzzle a hot beverage, but it can still produce that same effect that we're looking for. And then the other thing is really thinking about planning for starchy carbs for dinner. So this time of year, we do crave soups and stews, and just making sure that you have the allotment for maybe some extra potatoes, rice, pastas, things like that within your dinner. And again, we're not talking a huge serving size. All that to be said, if you find that you are struggling with seasonal affect disorder in a way that is impacting your ability to function, that you feel concerned about, please get help. You can certainly, this is something that therapists can really help with, and go beyond the scope of what your nutrition coach can do. So I hope that's helpful. I wanted to normalize again that craving of carbs is a natural kind of organic thing that can happen. But two, that it doesn't have to be the catalyst for total sabotage of your nutrition plan. So I hope that's helpful. Thanks.